Hello, this is Dr. David Greene, CEO of the TEX-PAIN Network. Today's topic is what you need to know about occipital nerve blocks. An occipital block is an injection of numbing medicine next to the occipital nerves, which are located on either side of the scalp, originating at the neck. There's a greater and a lesser. So you have the greater and there's a lesser occipital nerves. Neither has a motor function, they're only sensory. The injection is designed to stop the pain traveling along these nerves, which can lead to occipital neuralgia, cervicogenic headaches, and migraines. They serve both a diagnostic and a therapeutic purpose. The symptoms of occipital neuralgia include pain in either one or both sides of the head, a scalp that's tender, may have an aching, burning, throbbing pain, and patients can describe it as either a sharp or electrical shock in the back part of the neck and head. Who benefits from an occipital block? As mentioned, occipital neuralgia, those with pain on one side of the back of the head benefit the most. Migraine sufferers, those with cervicogenic headaches, which by definition is any headache caused by the neck, and typically that's one-sided as well. Cluster headaches can also benefit. These are one of the most painful headache types. The procedure is quick. It can be done in the office in just a few minutes. There's no need for sedation. The pain doctor will initially feel the point of maximum tenderness at the base of the skull, and then the doctor will move the needle to inject both the nerve areas. So you have the greater occipital area and then the lesser occipital. So usually they'll sort of span this area to try and get both. How well does the procedure work? For such a quick, low-risk procedure, it works amazingly well. Typically, pain relief is achieved within minutes. For cervicogenic headaches, 50 to 90% response rate, averaging 77 days. Cluster headaches, 85% response rate, which could be 4 weeks to 4 months. Occipital neuralgia, 85% response rate for 1 to 2 months. And then migraines achieved a 60% response rate, averaging 4 to 5 weeks. And these can easily be repeated when the pain relief wears off. So you can repeat the procedure when the pain relief wears off, or a patient can go on to have a pulsed or a regular radiofrequency ablation. And that is when a catheter is placed back in the region of the occipital nerves and heated up with thermal energy, and it deadens the occipital nerves for anywhere from weeks to months to over a year. It's a very low risk procedure. Remember, there's no motor function to these nerves. Are there risks? Very minimal. There could be a risk of some bleeding, infection, allergic reaction. The needle's outside the spinal canal, and these are not motor nerves, so you're not risking a nerve root injury. There's no risk of a CSF leak or a spinal cord injury because you're outside the whole canal. The top non-operative pain management in the Dallas-Fort Worth Metroplex area is with the TEX-PAIN Network. There are several clinics throughout the area, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the TEX-PAIN Network. Your pain stops here.